The opioid epidemic, frankly, could not be bigger because it is affecting every demographic in our country, every part of our country. No one is safe from this epidemic. Everyone has a family member of some sort who is suffering from this crisis. And that's why we need every layer of government and private industry, public health officials, everyone, law enforcement, to work together for a solution, because we're all going to have to deal with this in our lives one way or another.
My name is Matthew Horton. I am the Vice President of the Health Law Section of the Maryland State Bar Association, and I'm also a health law attorney at Baker Donelson. So tonight, we are here at the Baltimore offices of Baker Donelson, and we are hosting the joint meeting between the Maryland State Bar Association Health Law Section and the Bar Association of Baltimore City, the Health Law Committee. And we're jointly presenting a discussion and meeting on the topic of the opioid crisis here in Maryland. From a public health law perspective, this is a big issue because it's a problem that's treatable, and you're not going to use law enforcement to charge your way out of this issue.
Law can help alleviate the suffering, reduce the problem of opioid use disorders in a couple of ways. One is prevention. So it's much easier to stop people from starting than to stop people once they're using. At the same time, law and public health lawyers in particular can play a role by making sure that laws that get passed, number one, are going to be effective and can be implemented, and to assist those who are implementing them. Again, whether they're prevention-oriented or rehabilitation-oriented, it's important to know that those laws have a sound legal footing. This is the first time that I have done a talk with the State Bar Association. I'm excited to be here, in part because I think traditionally the health law sections of the bar, be the county bar or the state bar, city bar here, they've been folks who are focused on medical professionals or healthcare facilities. They represent insurance companies or hospitals, or they're in Medicaid and Medicare reimbursement, which is a whole different world. This is really exciting to me to see folks in the health law sections interested in public health law.
So if you're interested in health law or interested in the opioid epidemic like what we discussed tonight, please join the health law section or feel free to come out to one of our events.